Module 4A. Up to now in our tutorial, we have discussed a variety of cognitive strategies. We will now spend some time discussing some useful behavioral strategies, including activity monitoring, pleasure predicting experiments, relaxation training, exposure therapy, communication skills training, and role-playing. Behavioral interventions in cognitive behavior therapy are designed to increase activity levels, increase energy levels, and increase interest and pleasure, and decrease procrastination. Keep in mind that when there are positive behavioral changes, the patient's self-esteem improves and attitudes and beliefs can shift. For example, the patient may begin to say, "I can accomplish something." Similarly, changes in thought patterns can promote more adaptive behavior. For example, if I think I can accomplish something, I may try to do it. In other words, cognitive and behavioral interventions augment each other. Self-monitoring activities on a schedule can help the patient decide what changes can be useful to make. Rating pleasure and mastery levels for each activity can help the patient decide whether or not it makes sense to add more pleasurable activities to their schedule or to add activities which would give them a greater sense of accomplishment. These ratings can also show the patient if they are underestimating the pleasure or mastery they are receiving from their activities. We are trying to gather accurate data about activities. The directions we give the patient for using the activity schedule are to write down activities engaged in on an hour-to-hour basis to gather baseline information. Patients can also pre-plan a full day of activities or choose one or two activities to pre-plan. They can rate mastery and pleasure on a 1 to 5 rating scale following the activity. They should rate the action quickly. They should do the pre-planned activity even if they don't feel like it or it feels overwhelming. The activity schedule starts the process of self-monitoring and introduces the concept of challenging distorted beliefs. For example, I never accomplish anything, a negative event will go on forever. This is a blank activity schedule which you may download for your patients. In this slide, we see one completed day. Notice the activities and their accompanying ratings for pleasure, P, and mastery, M. We can see that for this patient, watching television does not provide any pleasure and mastery, while engaging in social contacts, for example, calling her mother, having dinner with a friend, gives increased pleasure and mastery. This can be helpful information which will help inform the patient about which changes she would like to experiment with. Patients who can benefit the most from activity scheduling are those that are passive or immobilized. Patients who are procrastinating, avoiding tasks, or reporting feeling stuck and unable to accomplish much. Patients who are struggling with initiating tasks, getting sidetracked, or report feeling overwhelmed by the thought of beginning a task. Patients who are reporting suicidal thoughts can also benefit from using the activity schedule. The nature of planning an activity on the schedule can undermine the hopeless notion that nothing will change for the person. Remember that the best way to use activity scheduling is to tailor it to the needs of the patient. If the patient is procrastinating, she can begin to put down manageable, achievable steps on the activity schedule. It is our job as therapists to troubleshoot any problems that could arise and make sure that the patient, before the patient leaves your office, that they can fully be prepared to accomplish their task. If the patient is suicidal, you can help the patient schedule items on the activity schedule that are achievable and could help dispel their overriding hopeless attitude. The rationale of how the activity schedule can be beneficial to patients should be explicitly outlined for the patient. They should completely understand why you are asking them to do this for homework and how they could benefit from it. For example, patients can benefit from the activity schedule by becoming aware of their daily activities, recognizing pleasure levels and sense of mastery or accomplishment derived from completing the task. Collecting information can also help patients see more clearly if their perceptions about their accomplishments or pleasure levels is accurate, or if they are realistically assessing their day. For example, it is not uncommon for a depressed person to say, "I don't get pleasure from anything," or "I never feel as though I accomplish anything." We can then help them notice how their distortions are operating and that they may be thinking in all or nothing terms. It is also helpful to see the facts written on the activity schedule to help the patient decide what they would like to change. For example, adding more mastery and pleasure activities or procrastinating less. It is also helpful to bring patients' attention to the fact that when they interact with others, they may feel more pleasure. The activity schedule can help change the patient's beliefs that they are doing nothing or not enjoying themselves at all. At the very least, the activity schedule can be used to gather more information about one's patterns of mood and behavior. We are, in a sense, flexing our muscles of awareness. The following are some tips to help improve compliance for homework assignments. Always collaborate on the specifics of the homework. Use Socratic questioning to collaboratively come up with an assignment together that makes sense to the patient. Always ask if the patient understands the assignment. Ask if the patient understands the rationale of the assignment. Also, ask if they think they can complete the assignment. It is helpful to plan ahead for all possible obstacles and how they will work around the potential problems. Encourage your patients to try homework even if they can't do it perfectly. Make sure to practice all exercises in session before sending the patient home to do the homework. Make the assignment achievable. Have the patient write down the assignment. Ask the patient what is the likelihood that they will complete the assignment on a 0 to 100% scale. If the patient responds with anything less than 90%, ask how can we make it more likely that you will try. It is also helpful to explore if there are any distorted beliefs or thoughts that the patient might have about the homework. For example, "I can't do this," or "I must do this perfectly." The following 5 downloadable handouts can help the patients move in the direction of change. It is always nice when we feel motivated and then we are active. With depression and anxiety, it is more likely that motivation will follow the action. That is, you feel like you can and want to only after you start to do it. Changes in mood will occur immediately or gradually, but they will occur with increased activity. It is helpful to monitor changes in your mood when you monitor your activities. Taking action on what you have been avoiding can strengthen the conviction that you are not hopeless, helpless, defeated, or powerless. Becoming less depressed and anxious requires a shift from being a victim or object of circumstance to being the actor or subject. With each active step, there are more opportunities for improved mood and more accurate thinking. The attitude we are trying to help patients adopt is to move forward in spite of their mood. Like the Energizer Bunny, just keep going. We are also trying to foster the awareness that action is better than avoidance. Taking action on what one is avoiding is one of the best ways to become less depressed. This action helps reduce negative thinking and shift one's mood. Action can lead to increased motivation. Action can also help improve self-esteem. It is helpful for patients to learn to give themselves credit for all accomplishments, no matter how small. Taking action can help with interpersonal relationships and that others may be less annoyed. Taking action is better than avoiding. Taking action can help reduce the tension and lethargy associated with avoidance and can lead to increased energy. Our bodies and minds feel better when we move. With each action, there is an opportunity to gain new insights and awareness. For example, when we approach a previously avoided action, we may find that we are capable of tolerating the anxiety associated with that behavior. Similarly, taking action challenges thoughts of helplessness and hopelessness. The following are tips for helping patients begin to take action. It is helpful to brainstorm with the patient to come up with examples of things that they are willing to try out. For example, taking a stand, surprising yourself with something, surprising someone else, doing the easiest step first, doing the hardest step first, doing something you've never done before. Varying your daily schedule, doing the opposite of what you feel like doing a little bit before avoiding, choosing actions that absorb your interest and concentration. Aim for balance in your life when scheduling activities, some for pleasure, some for mastery. Choose 10 helpful action steps that you can do each day. Each night, write down 10 success experiences that you set your mind to do and did. Act as if you are interested in an activity or as if you have the energy and motivation. This may help get the ball of energy or motivation rolling. Plan your day in advance. Break down big tasks into small, manageable steps. The following are tips for optimizing activity scheduling. Scheduling 1 or 2 days events at a time, describing each activity on an hour-to-hour basis specifically allows the patient to make it more manageable and achievable. Be flexible in your scheduling. Always have a plan B in case plan A does not work out. If you don't do the scheduled activity, just go on to the next item on your list. It can be helpful to use self-instruction to help you get moving, such as legs, get up from the chair, and take one step at a time. It can also be helpful to write a script for how you will act. First, I will jump out of bed, get dressed, eat breakfast, drive to work. Anything that the patient can do to help structure his or her day and commit to a plan of action can be helpful. An important rule of thumb for combating depression is not to lie down and pass the day. It is better to remain upright and physically active. If the patient is having trouble deciding what to schedule, begin with scheduling in normal routine behaviors or behaviors the patient used to do before they became depressed. To help decide what pleasurable activities to schedule, think about what the patient used to enjoy, such as hobbies, what the patient is interested in learning more about as well. The therapist can ask the patient, "What have you always wanted to try?" Lists of pleasurable activities can also be found online. It is important to brainstorm about mastery activities as well by asking questions like, what used to give you a sense of accomplishment in the past? It is helpful to recommend working on the easiest activity first and gradually increase to the more difficult. Rating levels of mastery is a subjective measure based on the patient's level of effort to accomplish the task. In other words, when getting out of bed is really difficult, they should rate mastery as a 4 or 5 out of 5. On a day when getting out of bed is easier, it may feel more like a 3 out of 5. It is always a good idea to give yourself time to reflect on accomplishments, to really notice what one was able to do. As a therapist, anything that you can do to help the patient question his or her overly negative, automatic, distorted perceptions can lead to more accurate thinking. changes in their behavior, and ultimately more adaptive functioning. One way that patients can learn to shift their overly negative predictions about perceived pleasure from an activity can be for them to construct a pleasure predicting experiment. Patients can be encouraged to construct an experiment to compare how much actual pleasure they get from an activity compared to what they initially predicted. This experiment can help the patient shift their ingrained negative expectations to more realistic expectations. Patients can use this pleasure predicting form to rate predicted satisfaction or pleasure before an event and then following the event, and then compare the scores. In this example, the patient was predicting how much pleasure or satisfaction they would get from attending a party, 2 out of 10, and the actual rating ended up being an 8 out of 10. This approach begins the process of the patient challenging his or her own ingrained, often faulty beliefs.